Mammograms can now help detect a risk for heart disease, in part thanks to AI. This is according to a study just published in the European Heart Journal, finding AI can analyze routine breast cancer screening scans to then detect calcium buildup in breast arteries, which could lead to heart attacks. So this may turn into a common screening into what some experts are calling a 2-for-1 health check. For more on what we need to know, I'm pleased to bring in Dr. Chauncey Crandall, cardiologist, best-selling author, and speaker known for combining medical expertise with faith-based perspectives on healing and heart health. Dr. Crandall, great to see you. What do you make of this new study, and how excited should we be? Another opportunity to get healthy and detect early heart issue.
Well, Bianca, I'm excited about this study, and really it's a breakthrough, because we know that women mostly start their mammograms at age 40, and now we can double down on this test, looking for calcification within the arteries of the breast. We've never really done that before. We've mentioned it before, but now we know out of this European heart study through Mayo Clinic and Emory Clinic that if you have calcification within the arteries of the breast, you are at increased risk for heart disease. And this testing can start early at age 40, when most women start their mammograms, and we can follow through and we can start initiating other studies to find out if there truly is heart disease. So this is a breakthrough study, and we need to continue working in this direction with artificial intelligence to help us out with these findings.
Yeah, very exciting. And it's another reason for women to also go get a mammogram. You know, you could find heart disease, but also breast cancer as well. So when they say it's a 2-for, pretty standard, that we think this may be something changing going forward. Talk to us. We've had some segments about AI and how it's going to be integrating. You know, a lot of people, especially at the forefront like you, understand the potential for the positive when it comes to AI, but some people watching may not exactly understand that. Dr. Crandall, what are some of the more exciting AI movements that you're seeing when it comes to medicine, when it comes to obviously preventative care and saving lives?
Well, Bianca, we're using AI in all directions in medicine. I will tell you that. We can overread x-rays, where we can pick up things maybe that a reader cannot pick up. We do this for cardiology with the Clearly study. We can see defects within the wall of the coronary artery based on flow studies with AI. But now we have this new tool for breast, so we can analyze breast, and we can diagnose heart disease earlier in women. You know, Bianca, in women historically, we were not looking at women and thinking about heart disease. But now with this new study, I believe we will get ahead of the diagnosis for women, and maybe even get further along than what we have for men, because we don't have an equivalent study for men. So calcification within the breast, we get a calcium score. If your score is high, you need further testing to determine if you have underlying heart disease.
Well, certainly encouraging, and I'm glad we're here to put a spotlight on it and get women thinking about this, get them to their doctors, get early detection, always key. Thank you so much, Dr. Crandall. Great to have you with us this Friday.
Thank you, Bianca.
And folks, just a reminder, Dr. Crandall also has a powerful online tool that helps detect hidden heart disease before the symptoms strike. It is called the Simple Heart Test. You can go to hearttest611.com and give yourself some online feedback on your risk. It takes just a few minutes to do, and it is free.
Information. Truth is freedom. Is Newsmax. It's real news for real people.